Now is the time to ask those sensitive questions.
Exactly.
Kasi it's relevant to the topic.
Tanong ko lang po kung if total hysterectomy na ang isang babae, ano mo pa po ang possible na maging cancer-related disease niya sa kanyang wala reproductive system.
So that's a good question, no? If you have pag total hysterectomy ka, first ano ba muna ang total hysterectomy? Hystero is uterus. Ectomy is puputulin mo. So hysterectomy is tatanggalin mo yung buong uterus. Kasama, pag sinabi mong total hysterectomy, kasama pati cervix. Okay? Kasi meron tinatawag na subtotal hysterectomy na iiwanan mo yung cervix. So ito, iba pa yan sa total hysterectomy, bilateral, salpingo-oophorectomy. Ibig sabihin, tatanggalin mo lahat. So ang question is total hysterectomy lang po. Okay. So ibig sabihin, wala ng cervix. So ang natitira na lang dyan, pag tinanggal namin yan, tinatahi namin doon, parang stop lang ang tawag. So para siyang dead end ng vagina. Okay. Now, ang question dyan, ano ang affected ng HPV, no? Kasi HPV are squamous cell cancers. Ibig sabihin, tulad na sabi ko, lahat ng orifices or lahat ng butas na lined by squamous epithelium. At ang natitira na lang dyan ay vagina at vulva, yung labas. No? Kaya lang, ano ang risk? Kapag kunwari, clear, kasi sinasend for histopath, ang hysterectomy, parang pinapa-biopsy, diba, yung specimen. Pag clear siya usually, very small risk na meron kang cancer of here, yung sa vagina at saka sa vulva. Tinatanong niyo lang po kung anong possibility. Pwedeng magkaroon, ang possibility ay sa vagina at saka sa vulva, pero very, very small risk na yun. How do you test for it? Some still advocate for a smear. Parang part of your workup, instead of pap smear, vaginal smear to clear you. Pero normally, pag kunyari, normal for a few years, some opt to every 3 years, some opt na huwag na lang. Depende rin sa age. Pero lalo na pag wala pong nakitang problem sa cervix, very small ang possibility.
I read from the internet na kahit po walang cervix, nagkakaroon pa rin po ng cancer.
Yes,
so
that's
may
true.
test po doon, which is I think is C2, something, na pwede pong i-try kung meron po positive po sa cancer.
Meron kung po yung cancer of the genital tract, the best will be a smear. Kasi po, kung marker, there are some, tawag po natin mga markers. Minsan po non-specific siya. Ito po, ang tawag natin local screening kasi po, ina-address mo yung talagang areas na pwedeng anuhan ng cancer. That is the recommended. Nagkakataon lang kasi dalawa pong klaseng smear. There is the old pap smear type, yung swab-based, na ang ginagamit ng doctor nyo ay either swab or wooden spatula, tas nilalagay sa slide. Eh meron pong tinatawag na liquid-based. So ang ginagawa dito, doon sa mga nagpapa-pap smear, the trend now is to use liquid-based cytology. Ang ginagamit dito ay parang plastic swab, plastic applicator, plastic instrument na ang dulo parang brush. Tapos isinisingit siya sa loob ng dito sa cervix, yung mismong butas. Tapos tina-turn. Tapos paglabas niya, it comes in a container with fluid, kaya siya liquid-based. Tapos siniswish mo dun sa fluid. Yung cells nandun na sa fluid, yun yung pinapadala for testing. So you can easily see if your doctor used liquid-based cytology, LBC ang tawag, or yung conventional pap smear sa slide. We recommend Mas kung may LBC, mas active, mas maganda yun.
Any differences in pricing, just for people's information?
Siguro mga 1. More or less, very, very little difference from the, siguro a few hundreds of pesos lang ang difference from the normal, You can always ask your ubigayan kung ano pong klaseng PAPS niya. That's important. It's a good question kasi yung screening is important. Screening and vaccination.
Segue lang, di ba? Actually, you addressed some of these questions, pero they're on the practical side, and it's probably worth revisiting them. One is, tahin ko na lang, ma'am, is the HPV vaccine free? And then related, around how much does a pap smear cost, and what preparations are needed for it to be done, like any restrictions, etc.?
Yes. Good questions. First of all, the vaccine is not free because it's expensive. It's to offer for free unless you have a national, a national procurement policy.
Which for now we don't have.
Which we don't have, and we don't have a healthcare delivery system that's comprehensive na national. Nasasagutin ng gobyerno yung mga vaccines. Walang ganun. So KKB, kanyang bayan. Although, what they have is your company or your institution can actually deal with the providers and ask for a fair, competitive price, like a discount kung marami kayo. You can work on that. That's what a lot of companies and schools do. If you can offer it for less, if marami kayo involved. Pwede yan. Pwede rin salary deduction. Health naman. Yeah. The next question is yung pap smear. Different costs across hospitals. 600. Kasi some hospitals, you have a separate payment for the actual smear, tapos meron pang PF yung doctor. So may ibang bayad yung lab, ibang bayad yung sa doctor. It can range from 600 to between 1 to 2,000 pesos. What the preparations? Ideally, you shouldn't have menses, of course. No? Dapat kasi it will affect the smear. Mid-cycle is usually okay. Pero kapag kagagaling lang ng menses, ma-affect yung smear mo. Abstain from intercourse the day before, or else we'll just see sperm cells. Also, don't douche. Alam niyo po yung vaginal douche? Kasi naging uso yun nun eh. Yung, you put, nung pang hindi uso yung mga preparations na pH, ganyan, ang naalala ko nung training, meron kaming vinegar douche. Hindi naman purong suka. Ano yan, parang vinegar solution. No? Ganon. Pero now, they don't advise douching. Yung ginagawa, nilalagay sa bote ng ketchup na plastic, tapos yung inaano pang linis, we don't do that anymore. Kasi, it's not advisable because it can actually propagate infection up the... Look at this, oh. It's open eh. Open yan eh. Tapos kahit sabihin mo, may opening dyan, you can propagate infection up, especially kung may mens kayo, itong cervical os o yung butas medyo open yan. So, pwede mag-propagate up. So, this is just, siguro, clean your external genitalia, come when you don't have any more spotting, mid-cycle, that's a good time for a pap smear. Tapos medyo you at least clean your external genitalia. Kasi ang nagpamatter naman yung loob eh.
Another question from our online viewers. About the vaccine, is it a one-time vaccine? How long is the effectivity of this to prevent HPV?
Oh, that's a good question. How many doses? 3 doses is the recommended. For cervix, you give it at 0 months. Ibig sabihin, yung time na nagpa-vaccinate ka, and then 1 month after, and then 6 months after the initial. 0, 1, 6. For Gardasil, it's 0, 2, 6. 2 months lang ang difference. How effective is it? I can only speak for in the interest of disclosure. I was a principal investigator, clinical trialist for the bivalent Cervarix, so I can disclose its effectivity. 7 to after 7 years, the levels, the protective levels are sustained. Sustained, ibig sabihin yung protective levels niya ay mataas pa rin. And there is no need for a booster. Kasi yun ang question, di ba? Kapag gano'ng ka-effective, kailan ka ba nagbibigay ng booster? Kunyari, MMR, ganyan. Kapag ang tendency ng protective levels ay nag-wane o bumababa. Di ba? Kasi may vaccines na gano'n eh. Hindi naman lahat ng vaccines protective for a long time. Yung iba, kailangan mo magbigay ng booster pag gano'n. Ito, so far, there has been no need for a booster. I cannot say the same for Gardasil kasi, there have been some reports that had concerns about its waning levels, but, they have been trying to address this and they've come up with a 9-valent, so it's still protective. That's the bottom line. Gardasil still protects. It's still protective. But we'll still see. We still have to monitor. The trials, the monitoring is still ongoing. No? So we can see if there's any need. But if you're going to extrapolate the results, mukhang hindi na. Talagang long-lasting sustain for surveillance.
Mas maganda po siya na wala kang hindi siya ganun ka-high-maintenance in terms of boosters.
I just also have to add this. We actually also did a study of if it's also effective kasi hindi naman lahat ng nakaka-complete ng 3 doses. Sometimes even 2 doses are effective. Of course, they wouldn't want to, that kasi the studies have been done on 3 doses. Tapos baka pag nalaman ng tao na, 2 doses, pwede na 2 doses na lang. But if you don't have it, if you, for some reason, you don't get the 3rd dose, you're still protected, which is good.
Here are a few other questions. How does the use of other contraceptives, such as birth control pills, affect the risk of getting HPV or cervical cancer?
It has 0 protection. No, actually, ganito. It has, you cannot be protected, you will just be protected from pregnancy. But when it comes to sexually transmitted infection, as I've mentioned, the best method, given the circumstances, is barrier. And even that is not 100%. Even assuming na hindi siya mabutas. Kasi sometimes iba nabubutas. Even if hindi siya mabutas. Kasi the barrier is between the penis, the shaft, and the vagina eh. But if in the course of the sexual activity, you rub against the pubic area to pubic area, and there's HPV high risk there, you can pass it on. So it's not protective, diba? Any point of contact with with a cell infected with HPV DNA, you can pass it on. Kaya nga pati fingering, diba sabi? You can that. But given the circumstances, better than nothing. Barrier, condom.
Let me just say, ma'am, also that you spared us from the gory details, but in fact, I mean, if people really knew how at least at the very least uncomfortable or rather unsightly HPV really is, I mean,
Yes.
it should be enough to encourage one to get the...
I was really, I couldn't show you kasi sabi ko nga, it's normal kunyari in medical conventions, it's parang our way of life, we show the actual lesions. Kaya lang, I was trying to be a little more circumspect kasi baka even nga, very nice picture of the genitalia, very sanitized, di ba? O parang very clinical. Pero if you could, I wanted to show, if you could see, unang-una, what cervical cancer looks like. Ay, naku. Ora mismo. And if you can, actually in practice, di ba, you don't even have to see, you can smell. There's a very distinct smell of cervical cancer. Kasi pag late stages na, the patient just sits there, you can smell it from afar. Kasi ganun kalala. Necrotic yung If you know that, or even benign lesions like genital warts, they look cauliflower-like. If you can imagine what a cauliflower, even cervical cancer looks cauliflower-like na may amoy. Genital cancer looks genital warts are smaller like wart-like lesions na they're not cancerous but very, it's hard because you have something growing in your private part. If you're pregnant, you can't deliver vaginally kasi it will obstruct the exit of the baby, and your baby might also get HPV infection. There's a condition called laryngeal papillomatosis. If your baby passes through an infected birth canal, you can pass on the HPV to your baby. Dami talagang repercussions.
And then, ma'am, I know of one case where the way to arrest an actual infection of HPV na anal warts is to burn it off.
Yes. That's actually...
So you burn it, every
yeah.
single one, on a very
That's
sensitive
true.
area.
That's true. Actually, if you have genital warts, if a person has genital warts, there are many, the mechanical way to remove it is cautery. You cauterize, yung susunugin mo isa-isa. Pwede rin na you apply a solution that makes it fall off. Para siyang, it's caustic, yung parang, actually pag nagtitreat kayo ng kulugo, di ba? Alam mo yung parang ganun, pero sa puwenta. Can you imagine? Imagine mo, iisa-isahin mo yon, tapos may i-apply ka na solution para it would sting, tapos para mag-shrivel up siya and malaglag. Yung mga ginagawa sa warts, sa mukha, yun na yung ginagawa. Pero, sa puweta o sa area, which is very sensitive kasi may pulsa yan. So it's very...
A few questions pa po. How often should women have pap smear test? And then, yung mga may PCOS or polycystic ovary syndrome, po ba ay mas prone sa STI or cervical cancer?
Okay. The first one is how often. The recommendations have been changing, no? But at least you have it for the... Siyempre, some people say it depends then on the age. See? Annual is good, but sometimes if you're clear, your doctor may move it to every 3 years. It depends on the findings. It will always depend on the findings and your age group. The second is PCOS. It's polycystic ovarian syndrome. That is a hormonal, a large part of that, a large part of the pathology is hormonal imbalance. So, with regards to STI protection or effect, no. Actually, it's mainly your hormonal levels, your LH-FSH ratio, your ovaries. This is more external. And yung sa STI,
This one is a question from online. There are times that during prolonged menstruation periods, some women experience itchiness and smelly discharge. What can be the reasons for these, and will this cause STIs?
Yun, that's the hard part, di ba? Pag babae, that's the burden of being women. It's hard kasi normally, in a regular cycle, minsan, meron talagang discharge. Tapos minsan, there's a certain maamoy na discharge na normal lang naman. Kaya kahit mabugas ka na mabugas, parang hindi ka komportable. Di ba kaya kumikita ang pH care, yung mga vaginal wash, yung mga... Wait, after your period, it is normal to have discharge na may smell. Kasi ano ba ang physiology ng period? Those are discarded uterine lining. And it takes time for the uterine, that's blood and cells and dead cells and dinidiscard nga. So it takes time pati to travel from the uterus, okay? From the uterus to the labas. Kaya nga dark red ang blood kasi it takes time So normally, and if you think na ang vaginal vault has the vaginal area, may normal flora yan may normal good bacteria. So syempre, that environment, minsan there will be a smell. The thing is, tas minsan syempre because of the Makate. The only way talaga to tell if it's normal or not will be to see a doctor. Kasi there is also a certain type of abnormal discharge naman. There's abnormal vaginal discharge that's bacterial but not STI. There's also discharge that's bacterial and STI. And there's abnormal discharge na hindi bacterial. Talagang yung chlamydia, yung mga ganon, na it's an STI. Tapos iba-iba yung gamot niya. Iba-iba yung pag-test niya. So the only way for sure to ascertain is to see a doctor. Para the doctor can see what it is, the doctor can do examinations. Kaya lang, on a regular, yung hindi lahat ng mabaho na discharge ay abnormal na. Hindi lahat ng makate. Clue, if the discharge, to know it's fungal is usually, parang, you know what cottage cheese looks like? Yung nagka-curdle na puti, na keso. Yung mga cottage cheese, pag mga ganun ang discharge, usually fungal yun, candida infection. Or pag medyo greenish, sometimes it's, greenish discharge, makate. Tapos may kasamang kate sa labas. That can be fungal. Of course, you do not, for sure, you have to consult. You have to consult pa rin. Pero just because you have it doesn't mean it's abnormal. It doesn't mean it's STI. Kinakabahan na ba kayo? Ano ba itong nararamdaman ko? Ganon. Kaya kailangan talaga mag-consult. Mag-consult.
Master Nas.
Hindi,
actually, huwag kayong kabahan, hindi ako magtatanong. Sa akin, reaction lang, may kinalaman sa pagpapalawak ng awareness tungkol dyan sa HPV. Kasi nakikita natin na pumapangalawa siya, na cause of death na mga yung cervical cancer, na cause ng death ng mga kababaihan, dapat lumawak yung awareness nito eh. Dapat yung mga tamang ahensya ng ating gobyerno makipag-collaborate sana sa mga media stations, sa LGUs, hanggang sa barangay, para lumalawak yung kaalaman. Kasi parang baka marami yata hindi nakakaalam nito.
True.
Diba?
Very good po. Isang bagsak.
Ganon. Yun lang po.
Tama po yan. That is actually our advice.
At saka kasi pag lumawak yung kaalaman nito at naalarma ang gobyerno, baka bumaba yung presyo ng vaccination.
Wala nang hindi ko sure ngayon. Kasi the reason why we have things like this is to create awareness actually. We do not expect you. That's why I did not go into ano ba yung mga sexually transmitted infections, gonorrhea, chlamydia, syphilis, ganyan. Kasi malay nyo ba kung ano yun? Ano ba yung ganyan? Mga specifics again, hindi. What we want to create what we want to create is awareness and that initiative and to be proactive. Why? Because you are the ones who can make a difference, not just in real life, not just in terms of policy, but in your immediate circle, your family. Let's start with your family. Family mo. Kung may anak ka na teenage, o babae, o basta may husband mo, yung friend mo na nagkukonsulta na hindi nagpapapap smear, your colleagues in the department, your office mates, di ba? Or people who come up to you and ask. What we want to create is awareness. Kung alam nyo itong mga bagay na to, you can make a difference. Or you can even, you can advocate for something in your place of work. Or in the school. We've known of schools who na parent-initiated, PTA-initiated ang requests for school-based vaccination. You can be proactive. Pagdating po sa gobyerno, hindi ko masabi. Kasi there is always an agenda. Punta na tayo sa Dingbaksha. Diba? That is, I'm sorry, that is not related to this, but I feel very strongly about that. Kasi it just shows what a very mismanaged issue can go. Kasi bottom line is Dingbaksha is beneficial if given to the right people. It can be very, very beneficial. Kailangan lang pag binigay mo sa tamang tao, sa tamang pasyente, malaking bagay. Ang problema, napangunahan na ng takot. Kaya yung dapat na na pwede pa sana maprotektahan, wala na. Eh, nadamay pa yung ibang vaccines. Now, we've had outbreaks of measles. Have you heard that? The vaccination of MMR has gone down in percentage. So that's why, when it comes to government, I cannot, to be fair, some government institutions are working hard towards awareness. Yung DOH, the frequently asked questions, DOH has something like that. They have a dedicated site and agency for sexually transmitted infections. In HIV, they've updated their registry. So we have 2017 statistics. They have FAQs for that. May mga agencies naman. Marami ang private na nag-create ng Yung isa pang factor. You also have, you know, everyone has an agenda. Even the manufacturers of the pharma, big pharma. Everyone has an agenda. That's why nga, now, in our setting, it's up to us to empower ourselves para we can make informed decisions. Kasi we can only make an informed decision kung alam mo what it's about. And the impact. Pag ganon, kahit paano sabihin ng gobyerno, kahit paano sabihin ng, aware ka, sabihin mo, gusto ko maprotektahan, I will do something about it. I can go naman to my doctor and ask about it. That's what we want to create, awareness. So, very good po yung point. Thank you. It's a very, very good point.
In terms po sa effort ng government, I think meron po kasi, well, ito is specific po sa HIV/AIDS. Merong branch or department dedicated for that, which is the RITM AIDS Research Group. So, ayun po, may mga initiatives sila like school caravan, they go to different universities. Kagaya ng sa UPLB, I think that's last year po. Parang topic nila is about HIV/AIDS, breaking the stigma about HIV, STIs, ganyan. Tapos may mga free HIV screenings din po. Tapos ang alam ko din, you can go to RATM to have free screening.
True.
O yun
And
po,
even
for those who want.
they even have a program for the drugs.
Yes.
HIV. Part of my training kasi is RITM. Yung subspecialty ko kasi is infectious disease of internal med at that time. So, nag-rotate ako doon. They have a dedicated, it's one of the centers talaga of centers for the study of HIV/AIDS. They have programs for they have programs for education. They even have programs for the management, the treatment, the medications. Maganda. Kaya lang, it's a very limited, di ba, yung sector, ina-address. You know, if you go to the provinces, you'd be surprised, ha? The vaccine was launched many years back. We started the study, the phase 3 trials, 2004. Mga 2011, 2010 onward. Matagal na yan no? Pero you'd think it doesn't even got media people like si Chris Aquino o sina Pia Magalona. You know, if you remember those ads na color pink, tapos may X, that's Cervarix. So, ang daming media campaign, ganun. Pero when you go to the grassroots, o kaya yung iba sa provinces, you'd be surprised na hindi nila alam na may ganung option. Isa pa dyan, yung syempre it's pricing and it's not offered by the government. So talagang the sector that can do something about it are the ones who have means, sadly.
Tsaka po kasi, yung HIV has been, yung attention na naibigay sa kanya, talagang para naman po sa HPV, right? I mean, kasi yung parang, I hope we're not waiting for another epidemic. Pero kasi based on your stats din, you could sit two people in a room, and if they're sexually active adults, one of them could. So one of those two people could have it presently or would have had it at least something.
I have a question lang, no? Before this talk, who of you were actually aware of HPV? I'd like a show of hands lang, just for my before this talk, meron ba sa inyo na aware about HPV, human papillomavirus? Or ngayon lang natin yun? It's so, that's,
So about 3 people, 4, 5, 6, around 6 out of 20.
diba? Considering na it's the most common infection, STI, it is the necessary cause of a cancer that's the second leading cause of death in women. Parang walang alam, hindi sila aware. Considering na it's so easy to pass it, and most important, preventable.
Yeah, I wanted to highlight that nga, ma'am. That it's preventable, and the stats for it's extremely positive of 97% sure ka na ma-prevent ang deaths. Really.
The awareness here is very low.
Yeah.
And considering that this is a university, this is a teaching institution, ha? Diba? It's really surprising. The awareness campaigns have not reached the intended targets. Really.
It's hardly ever talked about. I think, for example, in countries like the US, pinupush po nila kasi nila yung awareness to the point where the show Saturday Night Live is making fun of yung push ng HPV among girls vaccination. So sabi nila, ibigay na daw sa 9-year-olds kasi parang they start early in terms of
Yes,
activity.
that's true.
But I think for us, we're not quite there yet in terms of conversation as well.
So now that you're aware of it, you're in a position to, you can be influencers. Diba? Kung hindi man, at least kung meron kayong hindi masyadong gets, now at least you have the initiative to learn more and see what's applicable to you or your family or your sister or your friends. Pag may nagtanong sa inyo, pag meron sa inyo hindi pa nagpapapap smear, mga ganon, you can be proactive about, you can empower yourselves and be more proactive about your reproductive health. Kahit hindi kayo, kahit single kayo, kahit hindi kayo nag-sex, kahit wala kayong ganyan, you know naman na you don't need sexual intercourse to acquire that. Yung mga mga teenage na mga kapatid na, wala kang ginagawa, pero diba? One problem is it's hard, it's easy to say, but when you have a partner, parang ganyan, kunyari ako, I have all my kids, I have a 16, 18, 20-year-old. Tapos kunyari, wala pa naman mga relationships, pero paano pag meron, parang, gusto mo ba, pwede mo magbigay ng checklist? Paano mo magbibigay ng checklist na, diba, how can you tell about their activity or their exposure? You can't eh. If you ask them, will they disclose? No. Even when you get married or your husband, will you urirat your sex, diba? Or if you can't eh. So what can you do? It's hard.
I think one of the disservices that we experience is that an active sex life is glamorized in the media, pero an active sex life involves this.
Yes, true. It's not as remote, it's not as remote a possibility as you think. Kasi minsan pag sinabi mo, sexually transmitted, hindi naman magkakaroon, bait-bait ko. Kaya, hindi naman ako pupunta sa mga girly bar, hindi naman ako ganun-ganon. Kala nila, half of, like sabi ni Sir Ram, if there are 2 people in a room, one of them probably has HPV.
Medyo confused lang po kasi ako. Ano po ba yung difference between HPV and HIV?
Oh, very, very, that's a good question. Ang HIV is human immunodeficiency virus. Ang transmitted siya to sexual fluids, pwede sa blood, sa IV drug users, sa IV lines. Kaya ang doctors, medical people who operate, they are at risk. Any blood talsek, pwede. Sexual intercourse. The pathology, yung sakit na yon is, it brings down your immune system in such a way that you cannot fight off even sometimes the simplest infections. Kaya, nagiging yung sinasabing opportunistic infections, yung mga mas madali ka maka-acquire ng infection kasi yung panlaban mo panlaban mo parang compromised, immunocompromised ka. AIDS is the full-blown version of that. So you can have HIV or you have the virus in your system, but you don't have any manifestations. Pero pag lumaganap siya, parang spectrum yan eh. So AIDS. There is no cure for that. HIV. HPV, human papillomavirus, is transmitted to the skin cell. Kaya actually, in a way, mas siya. Kasi, skin cell lang eh. Pwede mo nang, kaya nga, nagkakaroon siya. Kaya cancer ang presentation niya, isang spectrum niya. Kasi all the areas of the body that are lined by that skin cell, squamous cell, which means anus, vagina, vulva, lahat yun, pwedeng magka-cancer. So those are two different things. Siyempre, the more in the all things considered, mas maano ang HIV. Kasi it's very systemic. HPV in a way is local. So, pero both of them are sexually transmitted infections and both of them are viruses. Meaning, wala kang cure. Di ba kaya ang flu, ang ganyan, ang virus walang cure. All you can do is be supportive. Kaya yung sinasabi ng antiviral, ganyan, it just modifies the presentation, but you cannot, it's not like an antibiotic that can actually kill the bacteria. Hindi. Sa virus, modified expression at most. Kaya pag simple viral infections, you wait like flu, mumps, measles. Ang gamot, we don't say gamot eh. Ang management dyan, supportive. Supportive. Fluids, paracetamol for the lagnat. You treat, you just support the patient. Kasi you will wait for the body to clear it yourself. I-clear ng body yun eh. Kusang ang virus kasi, may limited time of yan eh. May lifespan yan eh, sa katawan. So hindi ba yung common yan, sasabihin mo, viral, 3-day infection lang yan. Kasi in 3 days, para bang mauubos yung sarili niya. May lifespan yan. But that's not the case with HIV. HIV stays with you. HPV naman, kasi persistent, ang premise nga dyan, persistent infection. So, there's something in your makeup that makes you cannot clear it. Kasi nga, even HPV, pwede mo sana maklear. But if you have the high-risk type, at ikaw yung type na hindi mo makiklear, yun yung nagpo-proceed to cancer. So, two different things. There are some similarities, but two very different things.
Salamat sa pagtanong kasi kailangan natin na ma-inform. At in fact, so yung na-cover naman, napakadaming pang STIs. Talagang mahubos ang buong linggo sa ganoon. Ma'am, ihabol ko lang po isang tanong from an online participant. May findings po ba kayo sa effect ng contraceptive injections or implants sa incidence ng breast and uterine and cervical cancer? May experience kasi kami sa hilot na may implant, mas matigas ang breast area sa side ng implant as compared to a non-implant user.
I want to clarify, Sir Ram. The implant is?
The implant is, may findings po kayo sa contraceptive injections or implants, so contraceptive implant.
Yung contraceptive injections, in relation to breast cancer, breast and
uterine or cervical.
Breast, uterine, cervical. Contraceptive injections kasi, most of them are progesterone-based. The concern more with contraceptives, kasi hormonal is the estrogen. Estrogen, kasi kaya, in my span of, paiba-iba ang, when you review the literature on OCPs or oral contraceptive pills and breast cancer, you'll find conflict, depending on what year you check, conflicting yung evidence. Kasi dati nire-recommend siya. Kasi di ba, contraceptive pills is are combination of estrogen or progesterone, usually ganun yun. And you're interested about estrogen component kasi yun yung concern mo pag endometrial cancer, pag breast cancer. So you're relating that to that. Ang lipo is usually progesterone-based. So it's not really, there are not much, na-confuse na ako doon sa implant kasi Pag sinabi mo kasi implant, may mga implants na contraceptive implants na tinatawag. I-insert yan dito sa, have you heard of that? Yung may parang, they insert it under the skin, and then nagre-release siya at regular intervals ng ganyan. Hindi ko iniisip niya breast implant. Kasi tumigas daw. So, I'm not...
Hindi lang na-clarify, baka naman or breast implants dun sa...
Mas matigas.
Kaya mas matigas ang breast area sa side ng implant compared to non-implant user.
And, you know, kasi, when you have breast implants, napunta tayo sa mga breast implants. Nagdawak talaga na sa back siya, ganyan. You know, ang breast implant kasi, to a certain degree, some users will have some sort of yung tinatawag namin na fibrosis. Parang isipin mo lang, pag kunyari meron kang sugat, yung iba nasa atin peklatin, di ba? Yung iba hindi. Kasi it's the body's reaction when you implant a foreign body inside the body, a foreign object or material inside the body. The normal reaction of the body will be to contain that. Di ba? Nagde-develop ka ng fibrosis. Kaya mapapansin mo, di ba, minsan may mga sugat ka na parang mas matigas yung ilalim. Or kapag kunyari na cesarean, sino na cesarean dito yung ilalim, parang mas makapit o kaya mas matigas. There's a certain degree of that. Kaya you can't really totally correlate the hardness. But, that said, one of the signs of breast cancer can be changed in the consistency of the signs of sinasabi ng nipple retraction. Nipple retraction yung parang, o kaya may hardness o may lump. Kasi when you think about it, when you have a cancer, that's also the same as having something in your body that the body's trying to, the body's trying to contain or ganyan, can a certain degree of inflammation, fibrosis, gano'n. Kaya you cannot actually differentiate. You have to, the first thing will be to consult a doctor, and then you will have to undergo studies like you have mammography, and then you can have a breast ultrasound, and if you have you can do further studies depending on the findings. Pero there are ways to differentiate.
Alright, and then yung pong contraceptive implants, like twice a year or so pinapalitan. I think it's related to
Okay. Contraceptive implants, yun nga din. Kasi many of them are yung sa kunyari lipo. Actually, conflicting pa rin ang literature about that. Which is why, now nga, the more striking ang effect ng yung sa OCP. Kasi for a while, we even recommended, for the ones who are perimenopausal, yung estrogen replacement. Naabutan niyo ba yun? Yung time na kapag kasi pag nag-menopause ka na, yung ovaries mo hindi na nagre-release ng estrogen, ang dami-dami mong nararamdaman. May hot flush ka, may dryness ka. So for a while, we were recommending estrogen replacement. Para siyang pills, pero may estrogen siya to replace the ones na yun. Tapos bigla nagkaroon ng mga correlation with possibility for malignancy, so it was stopped. So like right now, hindi pa siya, the jury's still out kasi there's still conflicting evidence on hormones and malignancy. Pero yung contraceptive implant na, kung mostly progesterone yun, hindi pa siya.
Salamat po.